listening to the nation's premier source on health, beauty, and wellness. Detroit Nation with Dr. B. Elaine Arterberry. Lifestyle Driven.
This is Dr. Elaine Arterberry from Detroit Nation Radio, where we are lifestyle driven. Detroit Nation Radio is a premier source for beauty, health, and wellness. We are committed to showcasing individuals that are driving the nation, that are from Detroit and the nation, committed to health, beauty, and wellness. I'm absolutely delighted today to welcome today's guest, Dr. Charles Boyd. He is recognized nationally and internationally as an expert in facial plastic surgery. He is board certified by the highly elite American Board of Facial Plastic and Reconstructive Surgery. He's also a diplomat of the American Academy of Facial Plastic and Reconstructive Surgery, as well as a fellow in the American College of Surgeons. He is a U of M grad like myself and is fellowship trained. He is also board certified by the American Board of Otolaryngology and Head and Neck Surgery. Dr. Boyd is an absolute expert on facial rejuvenation, and I am delighted that he's here today. One of the things that's most exciting about the development in plastic surgery is the development of Botox. Today's driver of change is Alan Scott. In 1980s, the San Francisco ophthalmologist was looking for a cure for crossed eyes in monkeys. He was working at a research institute, and monkeys were experiencing crossed eyes, and he was looking for an injectable cure to paralyze the muscle and thus straighten the eye. What he found by using the botulism toxin was an unexpected side effect of his magical injection that left everybody else wide-eyed. This is commonly known now as Botox. Dr. Scott sold the company to Allergan, which manufactures Botox, for $8 million. And unfortunately stated that he wasn't a great businessman because Botox has made Allergan billions and billions of dollars and is the most commonly used plastic surgery procedure that in the nation today. I'm delighted that we'll be able to talk to Dr. Boyd about these procedures, and so I'd like to welcome Dr. Boyd to the station. Thank you, Dr. Boyd, for being here today. Dr. Boyd, are you there? Can you hear me? We're having a little bit of technical difficulty, so we are going to talk a little bit about the importance of maintaining your face and maintaining your beauty. Women have a difficult time. What happens as people age is they get evidence of dermal atrophy. That's sort of a fancy way for skin thickening. So all these things we put on the skin, whether it be Botox to fill the wrinkles, whether it be Retin-A to stop wrinkling, or whether it be glycolic acid, all these things help with dermal atrophy and help the skin rejuvenate. It's all about making the skin a little thicker. Dr. Boyd, are you there?
Yeah, I can barely hear you, but I'm on.
Okay, can you hear me now?
Yep, that's a little better.
Okay, great. We're having a little bit of technical difficulty. I am so glad you're here today. Tell me, the audience can hear you perfectly, so tell me a little bit about yourself.
Right, so I am a plastic surgeon here in the Detroit area. I've been in this area for almost 23 years now, I guess, and specialize mostly in kind of cosmetic skin rejuvenation, both surgical and non-surgical approaches. And that's really been one of the biggest, I would say, trends over the past 10 to 15 years is all of the new non-surgical approaches to kind of keeping us looking younger and healthier and more vibrant.
I think it's wonderful what you do. Is it rewarding to help people sort of improve their appearance and improve their self-esteem? Is it
Yeah,
rewarding for you
it
personally?
really is. I every day I kind of feel happy going to work. So, and I get the opportunity to make people feel better about themselves. And most people aren't. I think there's a misnomer that in the past people were trying to change themselves, or you think about Michael Jackson or some other people that have done these dramatic changes, but 99% of people aren't doing anything like that. They just want to look a little bit more refreshed.
Right. So what's the most exciting kind of procedures that you're doing? And so what do you really like to do?
Ah, well, I like it. One of the things is I like it all because it's all a
Good.
little different. So things around, obviously the most common things are like Botox and fillers now, and Botox has been around for, since about 2002 in terms of being FDA approved. It's still the most highly sought and highest satisfaction rate of any cosmetic procedure. But a lot of the changes have been with fillers. And fillers are natural substances that can now help lift and shape your face and really can make a huge difference. I would say probably the most exciting thing, the newest things, are some of the things that can permanently remove fat.
Oh,
It's
okay. What's that?
non-surgical. That can be done in an office, usually within minutes to an hour.
Is that thing that removes the double chin?
Yeah, yeah. So that's something called Kybella, and that's an injection that you can inject in the double chin. And again, it's a permanent solution to removing the fat in the double chin.
Oh, wow. Has that been a popular procedure for you?
Yeah, very popular. We did a segment on the local news after the Grammys this year, but it's very popular.
Um, Dr. Boyd, are you finding that more men? I know a lot of women seek out your services and plastic surgery in general, but are you finding that more men are coming to your office?
Yeah, absolutely. So in the past 5 years, the number of men seeking these services has increased about 85%. So, and it's not always a vanity thing. Many times it's a practical thing. So, we're working longer, we're in the workplace, and we want to look younger and vibrant, just like the ladies do.
Do you think it really makes a difference for men in their careers if
Yeah,
they,
I really do.
really?
We
In
hear
what way?
it all the time.
Really? What do you
And
hear?
I see a lot of my colleagues and contemporaries that are coming in and asking about, well, what do I do about this line, or how do I kind of lift this area here? So it's, I think that taboo is going away, and face it, we're in Detroit, right? We have a long history of men kind of dressing well and looking good. So I always say your face is the only outfit you wear every single day.
Oh, that's true. That's definitely true. Do you think it's because the men are vain, or do you think it's more practical? I want to get a new job.
Yeah,
I don't want to be
I think
eclipsed by the
I think it's
hipsters.
both, but I think it's the practicality is really winning out. And I think there's obviously all of us. I think there's a whole psychology around how we look physically and then how we feel emotionally. So if people are coming up to us and saying, "Oh, you look tired," or "Did you not get any sleep?" when you're feeling fine, that affects us psychologically. So no one likes to hear that.
Have you ever seen a real turnaround story? There was a very popular TV show, The Swan, which
Yes.
took sort of the ugly duckling and, made her into a glamorous swan. Have you ever seen that really happen in your practice?
Oh yes, oh yes. There's a funny story I can tell you where, and I won't reveal anything about the patient, but the patient came in and she said she had a big event. I think it was a retirement event that was coming up, and she said to me, she wanted to get several things done. So we did, some surgical and non-surgical work on her. And when she came back after the event, she was in my office and talking to me and my staff, and she said what a wonderful event it was and how she felt so beautiful. And she went on to say how her father never told her she was beautiful, and how this was the first time in her life that she really felt beautiful. And all these people were coming up to her saying how great she looked. And so it was a really touching story. And my staff person was in the room, I had a little tear in her eye. And then the patient said to me, she goes, "And Dr. Boyd, I wanted to call your name, but I just couldn't." And so we all had
It was
to
her
laugh
little
at that
secret,
because,
huh?
our community doesn't necessarily share what we do,
Right.
and that's okay, but it certainly can be transformative.
Oh, I think so. How do you think the television shows, the Swan, the doctors, the Beverly Hills television shows, do you think that's increased the acceptance of plastic surgery just for for cosmetic reasons? People used to think people who got plastic surgery are vain. I don't think so at all. I think it's very practical. Has the television shows, has it affected your practice?
I think it's been a two-way street. I think for the most part, it's certainly exposed people to what can be done and what is possible. I think some of the shows like that certainly increase the viewership. I also think some of the shows like The Doctors or Dr. Oz, where they actually show some of the procedures and show how it's done, has certainly expanded the pie. One of the most popular shows now, which a friend of mine is on, is Botched, right?
Oh, yeah.
So Botched doesn't necessarily, it tells you what can go wrong, but then you also see when you go to the right people, how those things can even be corrected. So
Right.
I think overall it's definitely helped make the consumer more educated, and I think that's definitely better for everyone.
Do you think those shows are real? I mean, the problems that they're seeing, do you think those are real problems, or are they sort of exaggerated for TV?
It's some of both. It is a reality TV show, but a lot of that stuff really happens. We see it. I see a lot of things in my practice as well where people have gone, literally to someone's basement and had something they'll go to someone that's not a physician or a nurse, and they'll have a substance injected into their lips or into their body or now into their, everyone's like, the Kim Kardashian butt, so they'll get all sorts of non-approved items put in, and then, many times it can cause major and permanent problems.
My mother used to have a saying that she used to put Pond's cold cream on her face, and she used to say that her face was like a rose, but her neck was like thorns because she
Right.
didn't take care of her neck.
Right.
Is it more important to people do a lot for their face, but do you think people are neglecting their necks? Because that neck can show
the
that
old
age.
saying goes, if you want to know someone's true age,
Yeah.
you look at their hands and you look at their neck.
Right.
And so, but we have treatments now for both, right? We have treatments now for hands and the neck as well. And so it is true, though, and I think that's really what the next trend, when you look at some of the new technology, has been kind of treating the body. So we have, like Kybella, the machines that can remove fat in the midsection and help to tighten skin, because those are some of those kind of telltale giveaways that we're aging.
Right. What do you think? I know you have a skincare line called Detroit Skin.
Yes.
Tell me about how you developed that, and what do you think people can do to take care of their skin?
Yeah. So I think that's the most important thing that we can all do, is to take care of the skin, right? It's the largest organ in our body, right? It's the one that everyone sees, and it tells a lot about us. A lot of, certainly a lot of our health diseases and other things sometimes even first manifest in the skin, particularly in the African American community. So I think taking care of it's very important. It starts with, of course, cleaning our skin well. So you need to clean and moisturize and protect. And part of the protection, even among African American patients, is using sunscreen, and particularly on the face, because the sun is the most common cause of aging. And how we see the aging is typically in our complexion. So we'll get dark spots or brown spots. And every time you go outside, even on a cloudy day, the UV rays from the sun can make those spots darker or make them last longer. So I'm a big advocate for using sunscreen. So that's part of the development of this Detroit Skin line. So this Detroit Skin line has specifically made for keeping our skin protected. So there's a lot of treatments for. So it's I think the most amazing sunscreen. I think sunscreen can be a problem. Even for me, a lot of sunscreens I don't like because it looks.
Hello. We're gonna take we're gonna take a quick break. We're having a technical difficulty. We were talking about the importance of sunscreen, which is such a huge thing. And many people don't realize that even if you have a brown complexion, you can absolutely get sunburned. It's the UVB radiation that is really protective. And so most sunscreens need to either have titanium dioxide or zinc oxide or some other things that allow SPF. And so I wonder, Dr. Poyd, what do you think is the most effective ingredient in sunscreen?
Yeah, was that to me? I'm sorry. I just
Yeah,
got
what's
back
the most
on.
effective ingredient in your sunscreens? Is it titanium dioxide? Is it zinc oxide? What do you think?
Yeah, so the titanium and the zinc dioxide are what are called physical barriers, and so they are, they're physically going on the skin to protect our skin. So we have a combination of both actually, so that we carry in the office. And the one thing around sunscreen is you need to sample them and you need to try them because individuals may have sensitivities to one or the other. Mm-hmm. And there's also a chemical block as well that you can use. Now, the one thing I always need to mention, or like to mention with sunscreens, is many of us are vitamin D deficient. And so number one, we don't get a lot of sun in Michigan. And so for me and other of my patients, advocate using it on your face and not on the body because we do need to get vitamin D, and you need to check your vitamin D level.
Oh, okay.
Vitamin D deficiency can be linked to some other things like heart disease, and so that's something that all your listeners certainly need to check.
How do you counsel patients? You do a lot of work with injections, but how do you counsel them? How do you know when it's time, the injections aren't working, and it's actually time to do a facelift or do a surgical procedure?
Yeah. I think that's the most important thing, and that's why you have to have a relationship. And so many people will come in, and they, may come in for surgery, and we say, well, you can do this with injectables, or vice versa. Some people come in for injectables, and they need surgery. And I think that's part of the experience and why you choose going to your healthcare provider, that they have the experience and they can be honest with you. I always say that, my goal and their goal is the same, right? And that's at the end of the day, at the end of the procedure, that they're happy with their choice and they've achieved what they want. So it's very easy in that way because we're both aligned the same way.
Right.
So, there's certain things where if you have a lot of sagging skin, particularly in the jowls and in the neck, the most effective treatment for that still is surgery.
Right.
But if it's maybe sagging underneath the eyes or in the cheeks, many times fillers or non-surgical things can correct that.
What, you have such exquisite training. You probably didn't hear me in the very beginning, and I was reading off your resume. And how, you have a very unique training history in terms of being trained in head and neck as well as facial and reconstructive surgery. How has that really prepared you to do what you do? Some injectables, some major surgery. How has that helped you?
Yeah, I think it's been tremendous because I have an understanding of all the different aspects, and so I did head and neck, and then I did plastics, and then actually I did some dermatology and treating understanding skin and treating skin cancers when I was on staff at U of M. So it really helps to, as you said before, know when it's time to do one procedure versus another one, or say, to the patients, well, you really don't need surgery at this time. Eventually, right, we all get to that point, but you really need to understand aging I always say aging is, we say beauty is only skin deep, but it really goes from the skin to the muscles to the fat pads and then all the way to the bone, because as we age, our skull and our bones change.
Right.
And that leads to a lot of the drooping and descent that we see on our face.
One of the things we were talking about, I was talking about when we had a little difficulty, I don't know if you heard me, is this whole concept of dermal atrophy and skin thinning. And there's so few products that will actually make the skin thicker or really make you deposit more collagen. So what kind of procedures do you do in the office? I know microdermabrasion, it's almost like you have to traumatize the skin to make it thick, or you have to use glycolic. So let's talk a little bit about that. How do you get the skin thicker? Because that's what gives you the youth.
There's no question. Yeah, you're absolutely right with that just point, because that's what happens when we age. We lose elasticity, our skin gets thinner, and that's why we start to see lines and wrinkles that we didn't see before. And even smile lines, I call smile lines like if you have a dimple or the fine lines around the mouth, not the nasolabial fold from the nose down, but the little ones in the corner of the mouth. Those are ones that you see later in life, and it really correlates to our skin getting thinner. Right. So there's several things that can thicken your skin. One of which, you're right, procedures like mild microdermabrasion or some facials, they work mostly on the epidermal level, so it's really the superficial level, but to really thicken the dermis, which is the thicker part of our skin, topically, Retin-A has been shown to do that. So Retin-A is a topical that you use at night, just a dab, but it's been clinically shown to decrease lines and wrinkles and to thicken the skin. It's also the product that you may start to peel a little bit, but eventually when you stay on it, the peeling will stop. So that's very important. Some of the newer products for skin are some of the growth factor products. So there are some products that have active growth factors in it, and they've also been shown to thicken the skin and increase elasticity. And you can use that on your face, you can use it on the neck, and you can use it on the hands. So these are kind of specialty products that you can really only have in a physician office. There's a lot of products that you may see online or over the counter.
Right.
But the ones that have the active ingredients, you have to go to a physician office to get. So beyond that, then you start looking at some of the devices. So some of the devices that can actually thicken collagen, one's called Ulthera. So Ulthera is a ultrasound device, so it introduces a sound wave into the skin, and it heats our tissue. So by heating the tissue around 40 degrees or higher, that's also been shown to stimulate collagen production. And so that's a great non-surgical procedure that you do maybe once a year to thicken the collagen, tighten the skin, and you can get some lifting and elevation. So any of the devices that heat, so Ulthera is one. There's one called a Venus Freeze. It is a radio frequency device. It also heats the skin, and you can use all over the body. And we have various laser devices that can also do that.
People say that you're a complete natural at what you do, that you were absolutely born to do this. And you talk about sort of a tagline, beauty, optimism, youth, dignity. What does that mean to you?
Yeah. Well, that happens to be my name, but those were, we looked at it and just kind of thought about what we're trying to achieve. And those are really the four main principles that we're trying to achieve. In terms of beauty, that specifically doesn't mean that you have to look a certain way, or your eyes have to be a certain way, or your neck has to be a certain way, but it's also an internal focus as well. And it is to kind of look and feel better about yourself, right? And I'm a strong believer and proponent that you don't have to change how you look or who you are or any necessarily any structures on your face to feel and look more and have more beauty. In terms of the optimism, that's really why everyone is there, right? So it's kind of what I talked about before. As we look better and feel better, it translates into our attitude, and it's really an internal drive. And conversely, it's true that it doesn't matter how you look if you don't have it internally. I'm never going to achieve it for my patients with an external procedure or surgery, and that's one of the things we also talk about with all of the patients is what's their motivation, what are they trying to achieve, but that having that optimism, that spirit, that life, that's really what drives me and my entire staff, and that's what puts a smile on my face, and we put the smile on our patients' faces as well. Youth, the youth is different than young, right? So most people aren't necessarily wanting to be young again, but they want to be more youthful. They want to look youthful, and they want to look vibrant because that's how we feel. We're living longer, we're healthier, we're more active, and so that youth is very important, and it ultimately comes down to dignity. And so the dignity is really about having your head up, doing things that really restore that pride and that feeling of accomplishment that I think we share with our patients when we kind of help them achieve what their goal is from coming into the office.
Oh, I think that's wonderful. How can our listeners get in touch with you, Dr. Boyd?
Yeah, so we have two different offices. One's in the Birmingham area, one's in Ann Arbor, and as well as I'm also licensed in Illinois and D.C. and Georgia and New York, and Florida as well. So, but if you can go to our website, which is www.boydbeauty.com, and that has a lot of information there, and that has all the phone numbers of the different offices. We also have a lot of videos and information that you can kind of learn about the procedures. Certainly call any of the offices, and my staff will be happy to help you kind of talk about what you need and come in for a consult.
Oh, I think that's great. Do you do anything besides facial? Do you do any other types of plastic surgery, breast augmentation, anything like that?
Yeah, we do certainly do body things as well. Those are some of and there's some really new, interesting devices around that as well. So the midsection and legs and tightening all over.
Oh, good. I think that's great. I thank everyone from listening today. I'm absolutely delighted that Dr. Boyd was here to share how we can all be more youthful and how we can tweak those things so people can get the exact look they want. This is Dr. Elaine Arterberry for Detroit Nation, bringing you a premier source of health, beauty, and wellness from Detroit. Follow us on Facebook, Instagram, and Twitter at 313 Nation Radio. And as always, achieve your personal best and beat it. See you next week.
Detroit Nation with Dr. V. Elaine Arterberry, driving the nation to health, beauty, and wellness. Lifestyle driven.
FM 88.1 WHPR, Highland Park. FM 88.1 WHPR, Highland Park.
Hi, this is Michael Scribb.